Well, let's welcome Dr. Nachiondo to Aging and Awesome. He's with Gastroenterology Consultants here in South Reno. Dr. Nachiondo, welcome.
Thanks, Kai.
We're talking about a very serious topic that affects, I think, all people, heartburn. You eat an entire pizza, you're going to get heartburn. It happens. But GERD is a little more serious, right? It's more of a diagnosis. Tell us about GERD.
Right, so GERD stands for gastroesophageal reflux disease. And Kai, we all have periodic episodes of reflux of the stomach contents up into the esophagus, particularly after we eat. But some of us get symptoms with those episodes, and that's what we call acid reflux. If a person has acid reflux, say 3 or more times a week, we call it GERD, or gastroesophageal reflux disease. And the implication is that there can be complications from that.
And when you diagnose an elderly person with GERD, much more serious for them, right?
Yeah, so elderly people, so first of all, GERD is the most common upper gastrointestinal disorder seen in our elderly patients, and they are more likely to have complications from it. Complications might include things like scar tissue formation or changes in the cells or even cancers in the esophagus.
Really? And now you guys here will diagnose that and treat that? What are the treatment options for something like that?
Yeah, so treatment options are numerous. I always start with behavioral options first. So one of the big ones is for our obese or overweight patients to work on a modest sustained weight loss. And even a weight loss of like 10 pounds can lead to a vast improvement in symptoms such as heartburn, burping, regurgitation, things like that.
What are the long-term implications of GERD? Because you're in pain, and that's no fun. So long-term implications are, I'm sure, more serious than just pain, right?
Long-term implications are definitely what we want to prevent, and again, so that could include things like inflammation in the esophagus. If a patient has severe enough inflammation, they might form ulcers and even have bleeding, which can lead to hospitalization and emergency procedures. Patients might get scar tissue formation and they can get a stricture, which is a tight spot. Tight spots in the esophagus can lead to problems swallowing, food, pills, things like that. Additionally, cells can change and patients can get what we call Barrett's esophagus. That's thought of as a precancerous change in the cells in the esophagus, and patients can even develop cancers there. So our goal with treatment, behavioral and medications, which are very effective, and sometimes surgical treatments for select patients, is to prevent those complications.
And would you say the majority of people who come in and see you are about 65 plus, or does this affect other people too?
Yeah, so acid reflux can affect anyone, certainly, but it's much more common among older patients. And the bottom line is that older patients are more likely to get the complications that we want to prevent, especially when we're thinking about cancer in the esophagus. We know that older patients are more likely to get that cancer, and especially obese patients and Caucasian males. So we really want to encourage patients to talk with their primary care providers about whether they should see a gastroenterologist to potentially have a screening endoscopy.
Right.
Endoscopy is a test that we employ to take a look directly with a small camera at the lining of the esophagus to detect those precancerous cells or early cancers ideally.
So really, you said 2 to 3 times a week if you're having this acid reflux, you could have GERD, right?
That's right.
That's the catalyst, 2 to 3 times a week?
That's right.
Otherwise, it's just regular heartburn?
Yeah, it's regular heartburn, which will typically respond to an as-needed use of an over-the-counter antacid.
Right, Tums or whatever. Okay.
Right.
Great, Dr. Nachiondo.
All right.
The burning question answerer. Thank you so much.